Hi, welcome to the Are You at Risk web seminar. Thank you for taking the time to go through the alcohol education presentation, Are You at Risk, presented by the Peer Health Educators. Are You at Risk is a workshop that focuses on alcohol safety for college students. The learning objective of this presentation are to raise awareness of safer behaviors regarding alcohol use, to help students assess drinking patterns and influence positive change where necessary, to increase awareness of the consequences of alcohol misuse, to help students develop skills and confidence when responding to potential alcohol overdose situations.
Drinking has become a ritual that students often see as an integral part of their college experience. Students enter into college with established drinking habits. Some habits have the risk of leading to alcohol abuse, in some cases alcohol-related death. Many students justify their poor drinking habits with "that's what college students do." Research has shown that more than 80% of college students drink alcohol, and almost half reported they were binge drinking in the past 2 weeks. All college students experience the effects of drinking in college, whether they drink or not.
This graph represents reported alcohol use within the past 30 days compared with how often students perceive the typical student on campus using alcohol within the same period of time. As you can see, there is a great divide between students' perception and the facts. This is a problem because when students think or perceive that their peers are drinking more, they're inclined to do the same to fit in with what they believe is the norm. For example, as seen on the chart, students perceive that 5.3% of students have never used alcohol, when actually 32.4% reported that they have never used alcohol.
Many people are surprised to learn what counts as a standard drink. Although these drinks are different sizes, each contains approximately the same amount of alcohol and counts as a single standard drink. When we're served a large red cup of beer, an over-poured glass of wine, or a single mixed drink, it's possible that the drink could contain much more alcohol than what is considered a standard drink. Although the standard drink amounts are helpful for following the health guidelines, they often do not reflect normal serving sizes, particularly in a college environment.
According to the Dietary Guidelines for Americans, moderate drinking is up to 1 drink per day for women and up to 2 drinks per day for men. Low-risk drinking levels, as defined by the National Institute on Alcohol Abuse and Alcoholism, define low-risk drinking as no more than 3 drinks a day and no more than 7 drinks per week for women, and no more than 4 drinks a day and no more than 14 drinks per week for men. It's important to know that low risk doesn't mean no risk. Even within these limits, people can have problems if they drink too fast, are taking medications that interact with alcohol, or are managing a health condition that can be affected by alcohol consumption, such as diabetes or heart disease. It's also important to note that you should not drink any alcohol if you're planning on driving or pregnant or trying to become pregnant.
The National Institute on Alcohol Abuse and Alcoholism defines binge drinking as a pattern of drinking that brings a person's blood alcohol concentration to 0.08. This typically occurs after 4 drinks for women and 5 drinks for men. Take note, this is just over the low-risk drinking limits we just discussed. 1 in 6 U.S. adults binge drink. Binge drinkers do so about 4 times a month. The average number of drinks per binge is 8.
Experts can make a distinction between alcohol misuse and alcoholism. Unlike alcoholism, alcohol misusers have some ability to set limits on their drinking. However, their alcohol use is still self-destructive and dangerous to themselves, and can progress into alcoholism. Some common signs of alcohol misuse include 1. Repeatedly neglecting responsibilities, such as performing poorly at work, poor or failing grades in school, or skipping out on commitments because you're hungover. 2. Alcohol use in dangerous situations, such as drinking and driving, drinking with prescription medication against the advice of your doctor. 3. Legal problems due to drinking, such as getting arrested for fights, drunk and disorderly conduct, domestic disputes, or DUI. 4. Continued drinking despite relationship problems, or 5. Drinking to distress. Many drinking problems start when people use alcohol to relieve stress.
There is not much difference between drinking alcohol at 9 in the morning and 9 at night. The hair of the dog is a drink that people consume in order to lessen the effects of their hangover. If people have consumed an excessive amount of alcohol the night before, they can have many unpleasant physical symptoms the next day. Although drinking alcohol in the morning after a heavy drinking session may alleviate the symptoms of a hangover, it is not recommended. It only puts off the symptoms, and it can too easily become a habit. Some of the dangers of drinking in the morning are: 1. Feeling the need to drink in the morning to face the day is a sign of a psychological dependence on alcohol. 2. Drinking in the morning can easily lead to drinking all day. 3. Drinking in the morning can make an individual more accident-prone. 4. Reduce productivity, struggle to maintain responsibilities. 5. Drinking in the morning is usually done alone. This means that the individual is drinking to feel the effects of alcohol, not be social. According to the National College Health Assessment conducted in spring 2013, 67.6% of CSU Stanislaus students drank alcohol in the last 12 months. The chart displayed shows some of the outcomes that those students experienced under the effects of alcohol. These outcomes include such things as regrets, injury, and unprotected sex. Please click on Carson's story to view the We're Awake Alive video to learn about Carson, a freshman from Cal Poly SLO who died from alcohol overdose.
Alcohol depresses nerves that control involuntary actions such as breathing and the gag reflex, which prevents choking. It is common for someone who drank an excessive amount of alcohol to vomit, since alcohol is an irritant to the stomach. There is then the danger of choking on vomit, which could cause death by asphyxiation in a person who is not conscious because of intoxication. You should also know that a person's blood alcohol concentration can continue to rise even while he or she is passed out. Even after a person stops drinking, alcohol in the stomach and the intestine continues to enter the bloodstream and circulate through the body. It is extremely dangerous to assume a person will be fine by sleeping it off. The signs of alcohol poisoning are as follows: mental confusion, unresponsive, which is unable to be roused or awakened, snoring or gasping for air, throwing up, hypothermia or low body temperature, usually identified by cold and clammy skin, erratic breathing, which includes slow breathing, which is fewer than 8 breaths per minute, and irregular breathing, which is 10 seconds or more between breaths, loss of consciousness, pale or blueness of skin. A person showing any of these signs requires immediate medical attention. Don't wait. If you suspect someone has alcohol poisoning, call 911 immediately.
The assessment is simple to score. Each response has a scoring range from 0 to 4 points. All of the scores of 8 or more should be added together to indicate hazardous and harmful drinking. After you have calculated your score, that since the effects of alcohol vary with average body weight and differences in metabolism, a score of 7 will increase the sensitivity for women and men over 65 years of age.
If your score was alarming to you in any way, you can reach out to any of these resources and talk to someone about your current alcohol use patterns. The Psychological Counseling Center is located in the MSR Building, Office 210, and is free service for CSU Stanislaus students. If you are interested in where we have obtained our information, here is a list of references that we use. Should you have more questions, you can visit the Health Education Office located in the Student Health Center and talk with our University Health Educator, Megan Rowe.